We continue with our theme on the country's ongoing power cuts and the devastating impact thereof. We are now crossing back to Springs, that's in the East Rand. That's where Newzroom Afrika's Linda Mnisi has been for the better part of the morning. It's a regional hospital, Linda, that you have been looking into and listening to your conversation with the CEO. Just that line where he spoke about an operation that was ongoing at one of the moments when power basically went out. It's miraculous that the doctors are still able to continue with their work and have their patients survive this ongoing power crisis. What's the department, their role in this as the custodians of the healthcare system in the province? What are they saying?
Well, Polly, that's the reason why they have these generators on sites, right, to ensure that at least for that period when there's load shedding, doctors are able to continue with their work. But now it seems there's a new challenge that, as you heard in this hospital, that the generator kicked in, but it ran for longer hours, more than it was, prescribed for, even therefore. So it's a new challenge given the longer hours that, the country's plunged into, darkness. So those are the challenges that are posed by Eskom, or rather power outages in these health facilities. You spoke earlier about an arrangement that they have with the municipality that this regional hospital would not be load shared, but even with that, there are more issues that are coming up, issues of cables that are beyond even these, arrangements, which means that if there isn't that functioning cable, they don't have a choice but to plunge this hospital into darkness. And if it takes longer, then it means the generators will run out of diesel. And who gets caught in between? It's the patients, it is the hospital itself. I'm joined now by the head of communications at Hauteng Health, Motalatale Modiba. Motalatale, thank you so much for your time. We've heard the issues at this hospital and the challenges that were posed over this weekend by load shedding. But if you could give us an overview of how things are looking like provincially with the hospitals. We heard how there were also similar challenges at the Jabulani Begimlangeni Hospital in Soweto.
Thank you, Linda. I think the challenge that is currently facing everyone else in the country does also affect us because our hospitals are located where communities are. Many of our hospitals are exempted from load shedding, as you correctly said, but as you've seen with this particular facility over the weekend, you do experience those challenges that are beyond even those arrangements. What we have done provincially is that we have ensured that there's regular maintenance now of the generators as a way of making sure that we've got that backup capacity. The issue around diesel supply, I know that in the past we've had challenges in terms of security of supply. We have dealt with those particular challenges to ensure that at least we're able to regularly continuously supply diesel to the facilities, and there's also uninterrupted power supply systems that some of these hospitals would have but those are stopgap measures that take you for a shorter period of time. We recently, the Mnisi would have announced that we have made a plea to even the provincial government to have another engagement with all municipalities just to ensure that we close those agreements in terms of being exempted from load shedding. And also, you know that the provincial government, through the MEC for Treasury, did announce in May during the budget vote that there is a program of solar power which is going to start with about 11 facilities. And I think that in the long term maybe might assist in terms of alleviating some of the pressures. But in the short term, we have to make do with the current reality that we find ourselves in. And our clinicians at facility level have to always make decisions that would then obviously be in the best interest of patients. What that means is that sometimes you are having a situation where you say elective surgeries, which are more scheduled and so forth, might have to maybe delay a bit so that you focus on those cases that are emergency, your cesarean beds and other emergencies that cannot wait. You have to then prioritize those just to ensure that we balance the situation that we find ourselves in and continue to still provide care to communities. And I think what we need perhaps to say is that because health is so central to everything else that's happening, it's maybe to be able to send a message to communities as well that it's important that also I think there's an element of understanding the situation that we're finding ourselves in as a country and to exercise patience as we try to find better ways to service them amidst the challenges that we are faced with.
It seems to me that with all these processes that you have in place, the diesels, the arrangement, these issues are beyond your control at this point. What do you tell South Africans who are worried about healthcare services, as you rightfully point out, that it's a critical service? What do you tell them now during a time like this, when even your arrangements that you have that will last you a short period of time sometimes don't even last, like we've seen in this hospital?
Look, we still want to assure the public that we remain committed to improving the level of service that we are rendering to them. There's a high level of commitment, and even in the midst of these challenges, among healthcare workers to continue rendering the services as best as they can. What we're appealing for is that there be cooperation between us and the public, and that understanding. We are, of course, engaging with multiple stakeholders in terms of how do we best manage the situation as it unfolds. And I think we can really appeal for a better understanding, and that cases that are not of emergency in nature, sometimes we will have to make way for those cases that are of emergency in nature, and that takes a bit of understanding, so that you don't say I've been queuing for longer and here comes a person who then jumps the queue and they are serviced. Clinicians make calls based on assessment that they make in terms of the type of care that is needed to the specific patient, and at times we have to then make those kind of decisions on the ground to be able to ensure that we save lives.
Talk to us about, the impact that this has had on other hospitals here in the province. I mean, we're in stage 6 and it's likely to continue. You speak about how you've put measures in place, but when one looks at things like infrastructure, we know, our hospitals are struggling with infrastructure and maintenance. What is the interim plan right now to ensure that structurally everything is working?
Look, correctly, as you've said, many of the challenges are not just confined to us as the Department of Health. They require a working together with other institutions of government and other agencies to be able to address those particular issues. And I think already there is that process of working together to ensure that we attend to the infrastructural issues in terms of refurbishing and servicing many of our infrastructural, we've got an aging infrastructure that requires it to be serviced. It's not going to happen overnight, but it's almost like we're fixing a car that is moving, because we can't pause services while at the same time we attend to these issues, and we need to strike a balance. But it's more about those intergovernmental relations between the various spheres of government, but not just government as well, including also even players within the private sector space, to say we have seen in other facilities where we have had institutions that are non-governmental who have also come on board to say we can help in this way. I mean, in some instances, you have seen where some institutions will come and say, can we maybe drill a borehole for you and assist you? It will assist, it assists to a certain degree. It doesn't solve the problem, but I think all hands that are able to come and assist where there is room to assist, we welcome those. But there is definitely a plan that has been worked on to say, in the short term and in the long term, how do we tackle some of these challenges? And I think we need to make it very clear to the public that many of the issues that we're dealing with are not going to be solved overnight. And it means that in the short term, we are going to have some of these teething issues, but there is definitely a commitment to be able to address the issues that are confronting us, and hopefully that the plans that are being put in place and the working together among the different role players would then lead to us having a more stable services being able to be rendered to communities.
All right. Motalatale Modiba there, the head of communications in the Hauteng Department of Health, talking to us about how healthcare workers have really their hands full during this time of load shedding and having to make critical decisions in order, of course, to make sure that they continue the business of the day, which is saving lives. It seems to me, from what he's telling us, that even with the measures that they have in place, those are only for a certain period of time. Beyond that, then the challenges start to kick in, and it brings the question around load shedding and how long, it lasts. Stage 6 is much longer than the usual stage 2 load shedding, and it's seemingly presenting challenges to these facilities.
Mnisi, thank you very much. Live for us in the Far East Rand Regional Hospital.